From Wana Brands, welcome to Enhance Your Life. I'm your host, Jonathan Small, and each week I talk to people from all sorts of professions and backgrounds about how cannabis has enhanced their lives and how this healing plant can enrich your life too. Hey everybody, welcome to the Enhance Your Life podcast. My name is John Small and I am your host. And, I get a lot of questions about the endocannabinoid system. What is the endocannabinoid system? Everybody thinks they know or has no idea what it is really. So I figured I would get the foremost expert, or certainly one of the most intelligent people talking about the endocannabinoid system today. And that is Dr. Rachel Knox, who is joining me on the phone. And Rachel is an MD and an MBA and a cannabinoid medicine specialist and a clinical endocannabinoligist. Did I say that right? It's such
you did.
I said it right. Dr. Knox is trained in family and integrative medicine, or Dr. Knox trained in family and integrative medicine before pursuing additional study in the areas of functional medicine, cannabinology, and endocannabinology.
There you go.
She is also
gotta say it with confidence.
I gotta say it with confidence. She is also a policy expert on cannabis and psychedelics health equity, and she is the creator and co-founder of the Cannabis Health Equity Movement and the Association of Cannabis Health Equity and Medicine, and a co-founder of Doctors Knox Incorporated. It's quite a bio. Rachel, welcome, or Dr. Knox, I should say, welcome to the podcast.
Thank you, Jonathan. Yeah, Doctor. When there are no other Knoxes around, Dr. Knox works.
Dr. Knox works.
Rachel
I like it.
Works.
Dr. Rachel,
Yes.
I like it. Thank you so much for coming on the show. You have such an interesting story. Before we kind of get into the endocannabinoid system, I'd love to hear your backstory. You come from a family of doctors, correct?
Mm-hmm.
And I'd love to find out sort of how you got into medicine and that whole thing, and then how you kind of moved over into the cannabinoid world.
Yeah, my parents were both the first physicians in their families. My dad in emergency medicine, my mom in anesthesiology. So yeah, my siblings and I grew up in a household with doctor parents, and 2 out of the 3 of us followed suit. My brother, my mom likes to call him the out lawyer. He's the eldest.
He's the lawyer
to business and law.
Well, it's not exactly like he's slumming it. Yeah, okay.
I know.
It's pretty overachieving family.
We all get it tickles her every time she uses that joke.
It's a good one.
It's clever. It is. It's good. But no, Jess and I, my sister, followed their footsteps into medicine. I got to be honest, before I applied to medical school, I didn't think it was going to be for me. I had intended to major in psychology and pre-med at Duke, and wound up majoring in African-American studies, and by happenstance, because I was learning a history I wasn't taught.
Mm-hmm.
Right, as a child, as a Black person in America. It was history I should have known.
Right.
History that would have been very important to my identity, growing up in this country. And by the time, I exhausted those courses, I was majoring in it. And I had this moment one day where I was like, you know what? I really want to get into advocating for this Black identity, if you will,
mm-hmm.
and wanted to go get a PhD in African-American studies and start African-American school. Like, I was just on this, we need a revolution,
right?
Sort of tip when it came to the health and well-being of the Black community in America. And I felt very strongly that it started with knowing our history, having a shared identity so that we could together imagine a destination for ourselves within this country and beyond. And I kicked this idea by my mom. She was like, you could do whatever you want as a doctor. So I was like,
you can still do this, but be a doctor first kind of thing.
Yes. She's like, you work too hard. You've come too far to not go for it. But just remember this. If you do medicine, do it differently. My parents' careers spanned many changes in, our conventional medical system. I like to call it the medical industrial complex. Mm-hmm. They saw it move into a more business model, right? A sick care model. And so they were very encouraging that we began to think outside of the box with respect to what we wanted to do with medicine. So my sister and I only applied to dual degree programs, MD, MBA schools.
Right.
We got into Tufts School of Medicine. It was the only dual program that offered a 4-year program instead of 5. We were already living in Boston. So it made sense.
Right.
So it made sense. So we actually enrolled in medical school at the same time, even though I'm 3 years older than her. And it was an incredible experience.
That is cool.
We learned the business of medicine. Mm-hmm. And that's where we learned that, this system has been built and molded and has evolved into a sick care system that commoditizes illness. Mm. And we were being taught to be, yes, men and women following prescription, protocol, algorithmic medicine, not to the purpose of healing people, but to managing people chronically.
Wow.
That was very frustrating for me, who was coming into medical school and wanting to change the world, right? And recognizing that in the conventional system, medical doctors and really healthcare professionals at large are just cogs in a wheel that's going down a trajectory that does not end in transformational healing, period. So I kind of begrudgingly continued into my medical studies. I decided to go into family and integrative medicine. And at the time, there were only a handful of programs that offered some integrative medicine and residency.
What does that mean, integrative medicine?
Curricula? Yeah, so there are physicians out here and other healthcare providers who understand that our medical system as we know it has its limitations. We're dumping billions, if not trillions of dollars into drug discovery and, procedural discovery and technologies that really aren't closing our disparity gaps, right? People in America are very sick. We're getting sicker despite all of these resources that we're pumping into the system. And I think just a bunch of folks began realizing we are so divorced from nature, from what is actually natural to us and for us. And we really should be looking at things like food and ecology to address disease at its root cause. And so you have lifestyle medicine.
Right.
It's a few decades old now, but lifestyle medicine, it's all about a vegan lifestyle. We have integrative medicine that is about integrating truly traditional, ancient, right, original healing practices into this conventional model, right? Recognizing there's room for all of it, truly. And then you have your functional medicine folks who are fundamentally committed to identifying the root cause of disease and then healing disease by addressing that illness at its root cause and making corrections right at the beginning of the trajectory instead of using, even botanical medicines, but certainly pharmaceutical drugs as Band-Aids. So that's that cohort. All 3 are vying for board subspecialization, right? So they can be recognized by the Federation of State Medical Boards. That's a whole process in and of itself, but I would say that's sort of new age conventional medicine that's trying to bring us back to our ancient and more traditional roots.
Right.
And so I found a family medicine program that offered Dr. Andrew Weil's integrative medicine fellowship, but into residency. So it was actually a pilot when I was going through. And that's when I was first exposed to natural medicine. And while I was in residency in family medicine and integrative medicine training, my parents started seeing patients in cannabis clinics back home in Oregon on the side. Mm-hmm. And we're gleaning incredible insights and sharing those with my sister and myself. My sister was in preventative medicine residency at the time. And the stories they shared with us, from just improving a patient's quality of life to actually managing patients on their cannabis and seeing their tumor shrink over time were success stories that we were not hearing
in your classes,
in our clinical, our primary care clinics.
Yeah. And so, it's cool that your parents turned you on to it.
I know it's, it's like, what do your parents think about this? Well,
they were for it, right?
They were for it and very curious. And I think like my sister and myself, I think they too had these aha moments through working with patients choosing cannabis as medicine. We're from Oregon. Oregon legalized medical use in 1998. It had been legal for quite a long time before my parents got into the space. But the short of it was there was a clinic that was a Dr. Short somehow, some way, they got in contact with my mom, asked her to film in one day with the encouragement of my brother, who, by the way, was a lawyer already by this time and a small business attorney at that, with a number of medical cannabis clients in California. So really, he was the first.
Yeah. He
encouraged her to give it a try, to check it out. And my mom's backstory is that she grew up in a very religious Pentecostal, family, and went to Cal Berkeley.
Mm-hmm.
And she says she never saw or smoked cannabis while she was there. We're like, Mom, okay,
really?
Sure. Yes. But her strict family, I mean, they taught that if you even said the word drug, you could go into hell, right? So her context is interesting. But like many other doctors trained in our conventional system, we're taught all of these things are drugs of abuse. She saw plenty of colleagues get sent to rehab because of their use of cannabis, amongst other things. And so she had her preconceived notions about it, but I think she was also looking for something new. And so she did give it a chance and was just blown away by the types of people she was seeing coming into these clinics looking for cannabis as a solution for them. I mean, let her describe it. She'll say, I saw grandmas and grandpas. I saw retired policemen and lawyers. I saw other doctors. I saw parents strolling their kids in. People from every walk of life were coming into these clinics wanting to be evaluated to use cannabis to treat something.
So what does doctors, so let's cut to Doctors Knox Inc. What does that do exactly?
I mean, we're primarily a brand that educates.
Right.
Right. By the time all four of us doctors got into this space, I think we were very interesting to folks, right? This is a family of doctors. They're interracial. They come from different fields within the conventional medical, system. Let's see what they have to say. And, we were getting invited to speak at conferences and events throughout the country and even internationally. And we just felt it was time that we, bottle ourselves up into Doctors Knox and have a vehicle to do, our own promotion.
Yeah.
So that was what Doctors Knox was about. But at the same time, we had, had set up our clinics, formerly American Cannabinoid clinics, soon to be Pivotal Health clinics, and out of an academy, which has been rebranded Pivotal EDU, where we were seeing patients in clinic and where we were developing formal education. So Doctors Knox is more of our brand.
It's more your brand, but people can still see you in clinics, all of you in different facets or different forms, or do you work out of a clinic and people can go to see you and consult with you?
Yeah. Currently my dad is the only one who is seeing patients in clinic, and he sees them in satellite clinics. So American Cannabinoid Clinics is closed for the year. We are rebranding as Pivotal Health Clinics, and we're reopening in 2023. We're from Oregon with psilocybin assisted therapy.
Oh, interesting.
So we're actually revamping our clinical model into what we've always dreamed it can be. So our doors are closed right now.
And then you're pivoting. All right.
We're pivoting. You got it.
So I can talk to you about a million things. I'm going to focus this particular conversation today on the endocannabinoid system because I get a lot of questions about this and because I don't fully understand it. And I've been writing about cannabis for a while now. When people try to everybody sort of feels like, if you talk to people about cannabis, they're always like, and we have this built-in endocannabinoid system that's in sync with the, with cannabinoids. Like that's proof that, cannabis is a natural plant that our bodies were just meant to. This is kind of the argument you get a lot. And it might be valid, but I don't think people really totally understand what the endocannabinoid system is. And I'd love to talk to an expert like you about what it is because you are an endocannabinoligist. So maybe let's start with a little 101 class here. We'll take us back to 101 here. But what is the endocannabinoid system? It's relatively new that we've discovered. I mean, it's been there forever, but it's relatively newly discovered, right? As a system in our. So can you explain it a bit to us?
Yeah, we're almost 30 years past its discovery. So I don't know, in the grand scheme of things, conventional medicine as we know it has been around for 100 years.
Okay.
So really 30 years isn't that recent.
Maybe. Okay.
Right?
So it's not that recent.
No, it's not.
But you think of other systems
our knowledge about it has been suppressed, right? From, bench to bedside, like to say, and I'll just say from the bench to mainstream, there has been very little social will, political will to get this information out. So I'll say that.
Okay.
But yes, so our endocannabinoid system is considered hundreds of millions of years old. It is a system, or really a network within the mammalian body, not just humans, that is in control of every other organ system, receptor network, and for the purpose of keeping these systems and networks and organs in harmony, in balance, right? The system's whole purpose is to really be like a checks and balance, I could say, but responding to internal and external stimuli and triggering activities or blocking activities such that we stay in balance. If we're perfectly balanced inside and out, you would expect us to be in perfect health. Well, we all know that day in and day out, we're exposed to all sorts of things, stressors, chemicals, our own thoughts, right? That can tip us in and out of balance, or really tip us out of balance. And our system, this innate, by way of an innate mechanism, by way of this feedback loop, right, is continuously processing this information and making sure the body responds in kind to what result? To keeping us healthy, as healthy as is possible, right? And so between the years of 1988 and 1995, the classical components of this system were discovered, right? The principal cannabinoid receptors, CB1 and CB2, two cannabinoid ligands that lock into those receptors, anandamide and 2-AG, and then the enzymes that create those ligands on demand, and the enzymes that degrade them, that break them down immediately after use, right? Okay. And the receptors and these ligands and these synthesizing and degrading enzymes work in a feedback loop that I just described, right? But when research really exploded during the early 2000s, after the United States got its patent on cannabinoids as a neuroprotectant and antioxidant in 1999, right? Or in 2003, researchers discovered that the system is much more complex than just its four classical components. So beginning in 2011, really, folks started expanding their understanding of the system to the endocannabinoid dome. And that's where we see other neurotransmitter networks coming into play that work in concert with this endocannabinoid system, right? We know that cannabinoids work beyond the cannabinoid receptor on those neurotransmitter systems too. And even some of the neurotransmitters, right? The chemical messengers that work in those systems, they can interplay with the endocannabinoid system as well. So these days we talk much more about the endocannabinoid dome, which brings in way more options than just cannabis.
Right.
One of the reasons my family is into psilocybin and psychedelics is that, we understand that the serotonergic system that psilocybin works on is a part of this bigger endocannabinoid dome. So to the endocannabinologist, we're not limited to an arsenal of cannabinoid products because we understand the mechanisms of action on this greater system, on this greater network, that many chemicals and substances and, foods and behaviors, what's the word?
Interact.
Well, yes, interact with. That wasn't the word I was going for, but yes.
I don't know.
Interacts with. Modulates.
Okay.
Yes.
But talk to me about, there's the dome, which brings in many other systems. How does the endocannabinoid system work in concert specifically with cannabinoids? Like when you consume a product or the plant, the cannabis plant, how is the system, the endocannabinoid system, working? And then, because you hear this word endocannabinoid, it sounds like are there cannabinoids in your body? I don't get that whole thing. Can you explain that to me?
Yeah. So, when 1998 researchers wanted to know how THC worked in the human body, they used a derivative of marinol to do so, right? They radio tagged this molecule, lit it up inside the human body, revealed the CB1 receptor. It was this vast network of just CB1 receptors that they identified that way throughout the brain and the body. And this was a similar process that took place when researchers discovered endorphins, right? When they're studying opioids.
Right.
We have these exogenous molecules that work on our system. If the system exists in the body, then there must be natural compounds that the body makes itself that works on this system, right? Surely these plant-based molecules weren't created just for this system. And they were right? That's how they discovered endorphins. So the same thought process went into the endocannabinoid system here. If there exists a CB1 receptor, and they named it cannabinoid receptor 1, right? So CB1, after the molecule that they used to discover it, cannabis, cannabinoid,
right?
They, thought there must be naturally occurring molecules in the human body that work on this receptor. And of course they were right. Right. So they discovered anandamide first, followed by 2-AG. Both of these compounds work directly on CB1, and they had discovered CB2 by that time too, and CB2. It's actually really remarkable is that 2-AG is the most abundant endogenous cannabinoid, meaning made in our body. More so than anandamide, but we think anandamide gets a lot more play because it was discovered first. It was named the bliss molecule, right? Really cute name. But yeah, so our body makes its own cannabinoids that work on the endocannabinoid system. And again, I mentioned that the system is hundreds of millions years old, whereas the cannabis plant is only around tens of millions years old. So this system within our bodies has existed for far longer than this cannabis plant. And so really this cannabis plant is producing molecules that mimic molecules in our body and not the other way around.
Oh, that's interesting.
Now we know there are hundreds of cannabinoids, right? There's over 100 cannabinoids in our body, and they do not all work the same way. I still hear people saying things like THC binds to CB1 and CBD binds to CB2. I don't know where anyone got that information.
Not on this podcast.
The data was clear, and it's been clear for quite a long time that, THC binds directly to CB1, it binds directly to CB2 at varying affinities, and that CBD does not bind directly to the receptor site on those receptors. CBD can bind allosterically or off-site, right, to CB1, and that's why it's one of the reasons why many of us believe that CBD can dampen the effects of THC when you use them together, right? That CBD molecule binds off-site, changes the conformation of that receptor site, which means it can change the behavior of anything that does lock to that site in CBD's presence, whether that's THC, whether that's anandamide or 2-AG, or any other molecule. It will slightly modify the activity, creating a slightly different downstream effect.
But that's not a mistake. I mean, that's nature's way of keeping balance.
Yes. Okay. Well, of course. Yeah. I mean, think about it.
Right.
I think moderation is law.
Right.
It's universal law. And we humans, in all of our knowledge and intellect and wisdom and hubris, right? We tend to live our lives on the excess, and we have found a way to, manipulate cannabis plants to express higher and higher amounts of THC at the expense of other molecules that were really probably intended to make sure that when we consume this plant, that the experiences that we have on this plant are balanced, are more balanced.
That's interesting. So you're not necessarily so in favor of when they modify a strain to be so much higher in THC than nature really intended it to be?
Not for commercial purposes. No. Because I will argue that where our wisdom does kick in, and where I think it's prudent to do just that, is when we're applying cannabis and other natural medicines or botanical medicines to personalized medicine and precision medicine.
Right.
There might be a reason, clinically speaking, why we would want someone to consume higher amounts of THC, even if it's not naturally occurring. But that's applying cannabis into a clinical model, right?
Right.
The average consumer who is looking for a recreational experience or even an entheogenic spiritual one, and they want a higher amount of THC to induce whatever outcome it is that they're seeking to achieve. I think there is a major disconnect between how much THC is necessary to achieve that versus how much THC should be bred and marketed to the average consumer. What is wholly true is that the experience of euphoria is mostly modified by the terpenes that complement THC and not the amount of THC itself. There is a threshold above which increasing amount of THC will not get you higher.
Right.
It will not. But we have a marketplace, right, that feeds off of really misinformation or disinformation.
Right. The more
that's artificially driving up costs. It's like the more THC, the higher I can charge for this product, and it works.
It's like proof. Yeah. It's like in the alcohol world, like saying something is this much proof. Yeah. And it's not, but it's not actually getting you any higher or, right.
Yes.
Yeah. It's
precisely. And so, from a, commercial perspective, I really want to see the industry mature into a more sophisticated model that places much more emphasis on, the ensemble that creates entourage effect and kind of like, sommeliers, right? We'll have interpreters or whatever we're calling them to teach folks how to, seek an experience based on the ensemble of molecules that are present in a cannabis plant.
It's interesting. I mean, sometimes you can't even find the terpene profile on products that you buy. And that's such an important part of, as you're saying, it's like the most important part. One of the most important parts.
It really is. And right now, the argument is that it will, like, testing for terpenes will be burdensome. It places an additional cost on testing centers, and that gets passed through to, the supply chain manufacturers, which will eventually result in higher prices for patients and consumers. But to me, I'm like, well, let's get with the testing lab. Let's figure out how to make this work because, a mature market, a sophisticated market is going to provide those details. And what I think is even more important for people choosing cannabis as medicine than just the average consumer looking for something to recreate with is that those terpenes are pharmacologically active too. They're medicine. They're therapeutic in and of themselves. And there are often times where we clinicians are making recommendations around terpenes,
right,
in addition to the cannabinoids, but with an emphasis on terpenes. And patients and consumers aren't able to identify products on the market that have them because they're not being tested for.
So the ECS, the endocannabinoid system, keeps the system in balance. It's all about balance. Is there a way that you can nurture that system? That system is an important part of your health and wellness.
Well, it is. There are a number of conditions that have been ascribed to ECS dysfunction, right? We have some diseases that we associate with endocannabinoid system hyperactivity, things like obesity, seizures, a little bit metabolic disorders, diabetes. And then we have what are considered the classical endocannabinoid deficiency syndromes, PTSD, fibromyalgia, autism is looking like it might be an endocannabinoid deficiency syndrome as well. And so from the functional medicine perspective, right, always looking for the root cause, the question should become, well, if the endocannabinoid system is intended to keep us in balance, and there's this host of diseases that are looking like endocannabinoid system dysfunction disorders, then what is at the root of endocannabinoid system dysfunction? And the leading causes of endocannabinoid system dysfunction are quite obvious. It's chronic use of prescription drugs. It's the standard American diet, right? Poor nutrition. It's constant chemical exposure, overexposure. It's stress, right? Physical stress, mental stress. Aging is something that we can't really control, but aging naturally contributes to a little bit of endocannabinoid system dysfunction. And then certainly genetics always, play, and the epigenetics of things always, has to come into the equation. But I think 4 to 6 of those I just mentioned are preventable causes of endocannabinoid system dysfunction. So there are certainly things you can do to, prevent dysfunction or begin to stimulate, healing in that system. And then the other thing we didn't mention, there are a lot of activities, there's behaviors that research has proven to stimulate the endocannabinoid system in a very similar fashion as cannabinoids, like yoga, meditation, exercise.
Mm-hmm. It's not just giving yourself cannabinoids.
Yes, correct. I mean, we have studies that demonstrate 168% increase in circulating anandamide, our bliss molecule, after running.
Mm-hmm.
So when it comes to endocannabinology and working with patients, it can't be all about the cannabis. It just can't be. And we're not, using everything in our arsenal to address endocannabinoid system dysfunction at its root, right? So we are talking about eliminating things from your life that contribute to endocannabinoid system dysfunction, and then engaging in practices that stimulate endocannabinoid system function. And I would argue that includes consuming cannabinoids in some form or fashion.
How do you know you have to see people like you, or even though you guys are closed for business right now, right? But, or just an integrative medicine specialist, like it's so hard for just the average citizen to know what they should be taking, how they should be consuming, what cannabinoids they should be consuming, which terpenes, I'm somebody who's been in this business a while, and it's hard for me to know. And sometimes even if I like something, I don't even know what's in it. So I can replicate that experience. So what's the bet? Like, what do you advise for people?
I mean, generally speaking, right. Most people are sick in this country. Let's start there. Most people are sick with what we describe as inflammatory conditions.
Yeah.
I'm waiting for thought leaders to connect the dots between inflammation and endocannabinoid systems.
Right.
But at any rate, inflammation is at the root of all the diseases I just described as ECS dysfunction and beyond. And so I think broadly speak, these compounds within this cannabis plant are anti-inflammatory. So I like to encourage people to be encouraged that when they're consuming cannabis products, well, naturally you are contributing to dimming that inflammation in the body, right? I mean, we like to put emphasis on CBD and THC. I think we place way more emphasis on CBD as being a natural anti-inflammatory. Mm-hmm. But, generally speaking, I think that's why the CBD boom was what it was, because people recognized that, at least CBD had a place in this $1 trillion, wellness industry.
Yeah.
And I think a lot of people, just by taking these, broad or full spectrum CBD products, are recognizing a decrease in inflammation. Now, again, that's just broadly applied.
Yeah.
Many more people are looking for precision results, right? Many more people are saying, well, I have condition XYZ. How do I specifically treat those things with CBD? Well, you don't necessarily.
Right.
And that's when we have to go back to the preclinical trials. Again, we're very limited by the dearth of clinical trials, but the preclinical data is telling us how these molecules work at the cellular and subcellular level. These preclinical trials do describe to us the receptors these cannabinoids and terpenes lock into and their downstream effects. So what are we supposed to do with those? Are we just supposed to wait until clinical trials, come and go to tell us exactly how they work in humans?
Right.
I say no.
Yeah, we can't.
I say no. People are already using cannabis. The cat is out the bag. So when we founded American Cannabinoid Clinics, we were claiming that we doctors have been trained in anatomy, physiology, pathophysiology, and pharmacology. We are uniquely suited to evaluate these preclinical data and make it make sense for the consumers who are already choosing cannabis, right? And understanding that, we felt liberated such that we could counsel patients on what this preclinical data is suggesting these cannabinoids could do. And when we started doing that, just the CBD to THC ratio sort of fell by the wayside. It's still very, very important. But that's when we recognize that we need to be talking about CBG, right? And THCV and this terpene and that terpene and that flavonoid, because this person has a specific outcome they're achieving. We know by way of this mechanism of action, by way of this molecule binding to this receptor, that we might be able to achieve success here. And that's exactly what we started to find. So no, you can't just throw any cannabis product at a patient and expect it to work. Like I said before, to a degree, a high quality cannabis product can address inflammation in the short term, right? Sure, picking up just something might diminish pain. It might help you sleep, but there's still like a plateau that I think a lot of consumers and patients reach using that model. They come to us when they want something to really work.
Yeah. Got it. Well, I could talk to you all day. This is so interesting. I feel like I learned a lot more just in the 40 minutes I got to speak with you. I got a master class here. Dr. Knox, thank you so much. If people want to find out more about what you're up to these days or what you guys are focusing on, where should they go? Should they follow you on Instagram? Is there a website? Like, what's the best way to know about what you're doing?
Oh my goodness. We're doing so much these days. Yeah. We aren't as active as we once were on our social platforms, but I mean, we're still reachable through them. I'm reachable through LinkedIn. I'm reachable through Instagram. My handle is the same across all my spaces. It's at Rachel Doc Knox. Mm-hmm. We have a contact form on drsknox.com, so people can access us that way. But we're in the lab. We have been a little dormant because we've been putting together some new health technologies that we hope will transform both the cannabis and psychedelic space.
So cool.
So
I'm looking forward to that.
Yeah. Yeah. And you can't do everything at once. I think that's been the hardest thing for us. Like for a while with the four of us, we're like, we can divide and conquer and like share clinical time with, I'm heavily involved in policy and regulation. Mm-hmm. So I spend a lot of my time in meetings. And so, my time in the clinic dwindled because of that. But that was what I was passionate about. And so we got away with, spreading love for quite a few years. But now we really want to create a system that will benefit more doctors like us, nurses like us, other traditional healers. We want to create a platform that ends the separation between ancient and traditional medicine and Western conventional medicine. And we think the endocannabinoid system is the thing that ties us all together.
The dome. Yeah.
The dome. Yes. It ties everything together. And so we want to use the best of what technology and information can provide us right now to create such a system that is educating, gleaning insights, helping us improve product development, right, in this space, all the while targeting the outcomes we want consumers and patients to be able to achieve. So yeah, we've been cooking.
Yeah, you guys got to be busier. You guys got to get busier. Well, thank you for doing all that you do, and I'm really looking forward to some of your discoveries and just all your work and the outcome of all your work. Even though it's going to happen in waves, it is happening. I'm so glad you're out there making it happen for everybody.
Yeah. No, it's a very interesting time,
and it's fun to be working with your family. What a lovely thing to be doing.
It is. Yeah, they're great. So yes, but we've been cooking.
All right.
And hopefully the next time you have me on this show, I can be like, yep, here it is.
Yeah, I'm excited about that. All right. Well, we'll definitely have you for that. Dr. Rachel Knox, thank you for sharing your time with us.
Thank you, Jonathan. Okay.
Enhance Your Life is brought to you by Wana, the #1 infused product in North America. Wana's entire process is designed to deliver the same great experience time after time. They have spent years fine-tuning their recipes so that their products are delicious, consistent, and potent. For more information, head on over to wanabrands.com. That's Wana, WANA, brands.com.